Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. Ten minutes past 8 o'clock. It is Monday morning, the 8th day of June, 2026. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE. 90.9 FM right here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on planet Earth, you've gone to our website to tune in, ksje.com. Maybe you're listening through the KSJE radio app, or you've asked your smart speaker to play KSJE. Welcome also to the people who are watching me right now. Those viewers are watching us live on the KSJE Facebook page and also on our YouTube channel. It's great to have you all with us this morning for the program. Coming up, we are talking with Presbyterian Medical Services, their big event coming up, the Drums of Fall. We'll give you a little bit of a preview on what they're planning for that big event, and of course how you can get involved too as maybe a vendor or a sponsor. So stay tuned for that coming up in the next few moments. Also talking more about the Totah behavioral health programs that Presbyterian Medical Services offers. So stay tuned for all of that coming up here in the next few moments on KSJE. Later on this hour, we'll be checking in with Lewis Campbell on our Monday Reboot segment. That's when I get to talk technology. That you will see and hear at 8:50 a.m. on KSJE today. Mikes will take over the studio at 9:06, Roving with the Arts, our weekday classical music program coming your way today. And don't forget, if you're a social media type person, you can also connect with KSJE on our other social media platforms like Instagram or Blue Sky or X, in addition to Facebook and YouTube. And if you're a podcast person, we publish new podcasts almost every day. You'll find them wherever you listen to podcasts, so subscribe and maybe discover a new local program that you may have missed recently. Also, don't forget about the KSJE radio app available at the App Store and on Google Play. You have our podcasts and live stream and all that right in your pocket. Outside our studios here at San Juan College, currently 71 degrees already this morning. We are expecting a mostly sunny day today, the high reaching 87 this afternoon. Overnight, mostly clear skies with a low of 63. Then tomorrow, mostly sunny but windy. We could see wind gusts on Tuesday up to 40 miles per hour. It'll be 89 for a high tomorrow, 61 overnight, sunshine 89 on Wednesday, sunny and 87 on Thursday, hitting 92 on Friday, cooling off to 90 degrees with sunshine on Saturday, and overnight lows, as you can see, in the mid to lower 60s. Back with my guest from Presbyterian Medical Services right after this on KSJE. KSJE is supported by San Juan Regional Medical Center, your community hospital serving the Four Corners. With a 115-year history of improving the quality of life, health, and care of individuals and families throughout our region. When life happens, San Juan Regional Medical Center is here to serve everybody. Find out more at sanjuanregional.com.
Now back to Studio A and the award-winning Scott Michlin morning program on KSJE.
And back in the studio this morning with my guest, who I mentioned, from Presbyterian Medical Services. And as always, when we have a guest from PMS, I always like to remind our audiences that I remain on the board of directors of Presbyterian Medical Services, and I'm proud to do that as well. Kristine Carlson-Werito is here this morning from Presbyterian Medical Services. Good morning and welcome back.
Good morning. Thank you for having me.
You bet. Good to have you here. Talk about a lot of things that you were involved with, of course, and we'll get to Totah in just a moment, but also we want to talk about the Drums of Fall event that you are already, you and a team are putting together. I know it's not just you, because it's a big job and a big event, but Drums of Fall are coming in September, right?
Yeah, I have a great committee that I work with for Drums of Fall. We're on September 12th this year. We'll be at the Coliseum at McGee Park.
Right, okay.
Very excited to have people come out. It's a competition powwow, meaning that we will be giving away cash prizes to winners. We have gourd and traditional jingle, all different kinds of dances.
Right.
Our head people for this year, our head gourd dancer is Denton Smith, our head man is Malcolm Duncan, and our head lady is Carlson-Werito.
Nice.
We do have a couple specials that they'll be offering, so it should be a great time for everybody to come out and just have a good time.
Yeah.
It is a fundraiser for Totah Behavioral Health, so all funds go to support substance abuse treatment for our population here.
Very good. And so entry is $5 a person, or families can get in for like 20 for a family of 5 or more, right?
Yes.
Got
Yeah.
it. And so that makes it pretty affordable for folks to come in. And it's kind of an all-day, well, I would assume an all-day event. I know when I was there last year, it was kind of an all-day event. It was already well underway by the time I got out there. So there's a lot going on.
Yeah, we're starting at 11. We run till about 8 or so. We'd love to have everybody come out and just check it out, see the sites, shop the vendors. We have tons of vendors. We do still have openings for
Right.
vendors. We have had some issues with our website, so if anybody's out there, is it okay to give the phone
Please.
number?
Yes, that's right.
So there's a backup phone number. If you're a vendor and you've tried to get on the website and had an issue, it should be up and running. If it's not, you can contact Jareen White. Her number is 505-443-4305.
Okay, and we put that on the board, on the screen as well by the QR code. The QR code should take you to the website, but if you're
Yes.
having problems, the phone number is what you can call to get around that problem.
Yes, and it may take you someplace else for issues, but it'll all come back to Jareen eventually, so
Right.
feel free to call her directly if you're having any issues at all registering.
Right. And vendors, like last year when I was there, I mean, it was just a lot of variety of items, of vendors, of just a lot of different things, right? And that's kind of what you're looking for?
Yeah, everything from jewelry to food to, painting and different types of artwork, really anything.
Right. I saw a lot of T-shirts. I think I saw a lot of car add-ons and things, car stuff, right? And just lots of different, really unique things too, though. And that was really cool because stuff I hadn't seen before anywhere.
Yeah, it's one of my favorite places to shop. I have to be honest. It's get a lot of Christmas presents there. I buy a lot of jewelry for myself because I'm a little bit of a jewelry freak. And,
Right.
just a great time. Great
Nice.
time.
And you can still be a sponsor as well if folks are listening this morning as well?
Yes, we are looking for sponsors. We do have a sponsorship package to ensure that all of our sponsors get advertising out of it. Please feel free to you can either contact Jareen at that number. You can contact me. My office number is 505-564-4804. Or you can go straight to the website. There's sponsorship information there as well.
Okay, very good. And gosh, this is the 21st annual Drums of Fall event?
Yeah, hard to believe it.
It is hard to believe because we're not any older, but
No.
the event is older. So that's amazing, but that's wonderful. And then for folks who want to come and dance, is that another registration or some other, or do they need to just know somebody, or how does that work?
So you can register online,
Okay.
or you can register when you come that day in person.
Okay.
There's no additional fees for dancers this year. There have been in the past.
I see.
There are not this year. So it's just the entrance fee.
And you attract folks from all over, I think, who come and dance at this event.
We do. We have people from Oklahoma, from Arizona, from Utah who come down. It really is a big event. We have about 800 people who come just to watch. Hoping to expand that this year.
You've got plenty of room in the Coliseum, so there's room. There's lots of folks that you have elbow room to sit and enjoy and kind of
lots of space.
soak it all in. So it's a great space and a great event, as I said. So
Yeah, and we'll have some really great food. We have some amazing food vendors.
that is true. I remember that from last year as well. So that's great. But it's the Drums of Fall. We'll talk more about it too at the end of the program. But it's coming up. I know it sounds like it's far away in September, but as we were just talking, it's already June. So it'll be here before we know it. So get signed up if you want to be a vendor or a performer or a dancer or a sponsor. The number's on the screen. And that's how you can call and make a commitment to supporting this great event for Presbyterian Medical Services and Totah Behavioral Health Authority. And that's the other thing I want to ask you about, Kristine, is your work with Totah, of course, and all the things that Totah now offers at the campus, really, of care, which is right there among all the buildings and things like that. And so there's a lot of different things that are going on in those buildings.
Yeah, we offer just a huge amount of services there. We have outpatient, kind of what you would, excuse me, kind of what you would expect when you talk about behavioral health services. We
Right.
have outpatient therapy, group, individual, family. We have case management services available. We have 2 traditional counselors on staff, so we have a whole traditional program which involves men's and women's sweat lodge, talking circle, traditional education, traditional activities, all kinds of things.
Nice. And that's really unique. I just want to stop you there for a minute because I think that's really worth mentioning because not every place offers traditional counseling services.
It's true. It's true. And we have done it since we opened. We've been open since 2011, I think. So,
Okay. I'll take your word for it.
Yeah. We've been open a long time.
A long time too. Exactly.
But we also, we're able to offer services both in English and Navajo, which I think is very helpful for our population.
Right.
And then we also have some additional services. We have the Joint Intervention Program, which is really for people who have not done well in other treatment and needing kind of longer-term extensive treatment. It's actually a year-long program, 6 months of treatment, 6 months of aftercare. And there's a dormitory on campus for individuals enrolled in that program, which includes all of the services that we offer.
Right.
We have the Sobering Center, so individuals who are currently intoxicated and needing a place to sober up and referrals into treatment. That program runs 24/7, never closes. And
all year long.
All year long.
Right, okay.
Yeah. And then behind that building, we have our expansion services, which are really, if you need a kind of a crisis type shelter, an overnight place to stay, that's open from 5 p.m. to 7 a.m. Unfortunately, our services are adults only. We're not licensed for children, but if you're an adult needing a place to stay, we're happy to have you. Again, we open at 5, run till 7. We do offer a little bit of food there while you're staying there, a comfortable, safe place to sleep. Great staff. And then very exciting, the newer addition to, the next addition to our campus will be the Crisis Triage Center. And that's coming hopefully 2027.
Okay.
And that will be a place for people experiencing a mental health crisis to go. So we're super excited about that.
Yeah, that's really great. And again, all these things are kind of organized by PMS, but put together with partnerships with other entities in the community.
Yes.
It's not just a PMS entity, basically, right? And I want to make sure we talk about those partnerships.
Yeah, we have great funding partnerships with the city, the county, and the hospital. They have been tremendously great to us. We have partnerships with the courts and with law enforcement. We have a new officer for our joint intervention program. I believe it's Officer McPherson, just started with us, so we're excited about that. FPD allows an officer to work directly with all of our individuals in the JIP program, which is a great just way to do treatment.
Sure. And a lot of these are kind of this new look, I think, at the issue of behavioral health and things like that, that it's not just taking people to jail or taking people to the emergency department or things like that. I think there's been a lot of training on the law enforcement side of things, and certainly I think a lot of advocacy from your side as well, and the folks that work on your team to say, let's figure something out for these people in our community who are maybe going through a crisis, and maybe jail is not the best answer, and maybe we can come up with something better. And that's how we have some of these programs now, correct?
Yeah, absolutely. It's a community-based approach. And I want to share we have a great free program for family members who have someone that you'd like to get into treatment or who is in treatment and you need a little support for yourself, or you want to support them through that process. Right. And it's called CRAFT. It stands for Community Reinforcement Approach Family Training. That is Thursdays from 3 to 4:30. And again, that is open to the public. It's free to anyone who wants to come. And it's for family members, really, to give you that. Here are the tools that maybe therapists use to work with your family members that you can have so that you can work with your family members and maybe help get them into treatment or support them through their process.
Interesting, because that's a question I imagine that you hear a lot is maybe someone will come and say, I've got this family member, they're in some kind of crisis. I don't know where they're living. They could be on the streets. They could be in their car. I don't know. What can I do, or is there anything I can do to get them into some kind of a treatment, to get them back on a better path than where they are? Is that kind of what we're talking about?
Yeah, it gives you all the tools you need to go through that process. There's a total of 12 weeks of information, but you can sort of hit or miss, come for one, come for all of them, but just give it a try.
Right, true, very true. And then is that something where you can share resources, whether it's PMS or elsewhere, about where these families can turn, I guess, to maybe help their loved one?
Yes, absolutely. The class itself is offered at Totah Behavioral Health in the outpatient building. Mm-hmm. Yeah, and it'll help connect you to other services as well.
Gotcha. Very good. And for some of these things, again, for folks who are coming to see you, is it kind of self-referred? Is it coming from law enforcement or the courts or all the above?
All of the above.
Okay.
Yeah, all of the above.
And so that's how they find you. That's how they come in.
Yes.
Basically.
Yeah.
And if someone does not want to be there, they're not forced to stay there necessarily?
No, all of our services are voluntary.
Okay.
Yeah. Now, if you're court ordered, the court's going to have its own,
Sure.
consequence if you choose not to participate. But
Right.
on our behalf, everything is voluntary.
Got it. Got it. Very good. And having that traditional counseling, I just want to go back to that for a minute because I think it's so unique and so interesting because you have the sweat lodges are there and you have all that. And that's really meaningful and really important, I think, for our Native American community to be able to come and maybe, go through that and get that type of counseling and healing and again, some of that reinforcement, I think, of some of the things that maybe they learned when they were younger and maybe had forgotten over the years or something.
Yeah, absolutely. Absolutely. And we refer to people differently on the Totah campus. We don't say that we have clients. We say we have relatives. And we really work on that whole connection back to family and community.
Right.
As just a keystone to all of the treatments that really are pivotal place.
Sure. And that's an important, I think, definition as well, to talk to use that term. Instead of
Yes.
clients, instead of that, and saying relatives, and that's important. And I think the folks that are in those programs kind of do sometimes feel like a family. They've been through it together, and when they graduate from a program, they're kind of graduating together and things like that too. And that's a big celebration, I know.
Yeah, absolutely. We celebrate once a month. We have pro-social events the last Wednesday of every month. Those are also open to the community if you want to come and check out what we have. We have a free lunch and then different types of activities. I think we're doing tie-dyeing and variation of volleyball this month. A lot of fun.
Right.
Would really encourage people to check it out. You don't have to be Native to attend our Native healing practices. They're open to anyone who's interested. We can also have individual time if people are just curious and they want to get some more information or check it out. Our two traditional counselors are Anna Holliday and Wilfred Moses, and they're always up for talking about their program.
Nice, very good. Well, it's a great program. I know it does a lot of good work in the community, and I think again from talking just dollars and cents, I think again the reason that you have so much buy-in from the city and the county and the hospitals because they can see that it's helping people first and foremost, and it's saving dollars for taxpayers and for county residents and city residents because you're kind of helping these folks before they become in the emergency department or before they go to jail or before they take up a cell or something like that, right?
Yeah, we're keeping them out of the emergency room, out of jail, as you said, trying to limit their contacts with law enforcement or with EMS. And so, these are people who are high utilizers of services, and then, throughout the program, we track them before and after and show significant decreases in utilization of all of those services. Many of our graduates manage to stay out of contact,
right.
Which is just great. That's the goal. And we hope that along the way they also get housed and employed and all of those things that we all like to have as part of our life.
Of course. But again, once they get rid of some of the issues that they have, whether it's alcohol or drugs or what have you, the other things become a lot more feasible to be able to achieve.
Absolutely.
When you're not dealing with those other addiction problems and things
Absolutely.
like that. So that's really an important part of this. And again, saving money. And this program's been going, these programs, plural, have been going for so long now. You have some of this data to back up what you're talking about. I know that was kind of the pitch when these were first proposed to say, if we do this, it'll save X, Y, and Z. And now I think you have the data to back that up, that yes, in fact, these have saved X, Y, and Z when it comes to emergency department visits or jail visits or whatever, law enforcement encounters, things like that.
We do. We're currently analyzing our data from last year. It takes us quite a while. It's a bit tedious. But, on average, we've saved around, the first year we were open, we saved $300,000 to the city, the county, and the government with our pilot project.
Right.
That number I always have in the top of my head. I know we've shown a decrease over the years of 70% in contacts with EMS, 50% decrease in contacts with law enforcement. So you start to see those big drops.
Right.
Yeah.
Very exciting. So congratulations, because I know that was a big conversation. And again, I think, these other partners are really impressed with the numbers, and that's why they're still supporting the work that's being done, because they can see the results, and they're positive results. So that's really great. You mentioned the triage center. I wanted to ask you just a bit more about that new project that's coming online maybe next year. And the idea would be to have these services available 24/7 and they're at the Totah campus and things like that. Is that kind of the plan?
That is a plan, and that's a county project, so very exciting.
Got you. And will there be, I think I've heard a little bit about some mobile services too. Is that also part of this or a separate part of this?
So it's both. They're up and running already. We have
right.
mobile crisis up and ready, and they will be part of the crisis triage center as well.
Got you. And is the mobile part of Totah as well, or separate?
That's part of PMS. It's part of the Farmington Community Health Center.
Thank you. Okay. I should know that, right? But I knew there was some connection there, but that's important. And that's already running. And so the concept there, and I know it's not your purview of what you do every day, but I know the concept is to kind of be able to have a behavioral health person available when someone is in crisis 24 hours a day, 7 days a week. It's kind of the idea, right? Which is a big deal.
Yeah, absolutely. We have 2 people who respond. We have a therapist who responds with either a peer support specialist or an EMT. And we're currently responding to Farmington PD uses us, Bloomfield PD, Aztec PD, the Sheriff's Office. We're working with the schools. We're in some of the schools. We'd like to be in all the schools. So it's just, and 988. So if you call 988 in a crisis, you could have mobile crisis respond to you if you choose.
Nice.
And we come to your home or wherever you're at.
Right, wherever that person's having the issue, right, is the idea. And again, this is brand new, and so prior to this, the answer was just send law enforcement, cross your fingers, maybe try to get someone in treatment. Maybe it'll take 5 days, 3 days, maybe longer. Who knows? Is that kind of the idea of the old system?
That is the old system, and now you can get your behavioral health assessment essentially on the spot if that's what you want.
Right.
We can get you immediately into services. We can reconnect you with previous services you may have had somewhere in the community. Doesn't have to be PMS. Or if there's a place you've been trying to, we can help facilitate those connections as well.
Excellent. Well, I think that's a great addition to the services that we have in the community. And again, we always hear how we need more behavioral health services, more mental health services, things like that. And it sounds like the county and the other folks in PMS are trying to step up to fill that gap and make that almost immediate. And that's really important too. When someone's in crisis, I think getting someone to deal with them, to listen to them and understand and maybe figure out the next steps for them immediately is a big plus.
Absolutely. And again, I just have to give a shout out for the partnerships with law enforcement because the officers are fantastic.
That's great. And again, that's a new kind of, at least to me, a new approach from law enforcement to look at these folks who are in crisis, they're getting some training too to understand where that may be coming from, and then the other services and resources in the community to bring along with them, kind of thing?
Yeah, one of the great things about that is that we have some trained crisis officers in our community, and the Sheriff's Department recently has included my staff in their training protocol.
Nice.
And so that's been a great partnership kind of all the way around.
Right. Very good.
Yeah.
And so when they come across a call, I guess, then they're able to kind of go on that training to say, oh, this isn't just a shoplifting. This is something more than just a shoplifting or something like that. Is that kind of the idea that they find?
Yeah, absolutely. They can say this is something that be appropriate for mobile crisis. They have our direct line. They call us, and we're happy to go out.
Got you. And again, it's 24/7. Yeah. And that's got to be, because I think finding people to do that work is difficult anyway. Finding someone to do that work 24/7 is even maybe more complicated.
Oh, absolutely. I have to give a shout out to my staff. They're fabulous.
Right. And that's again, it's great to be able to do that. And is this something I think that the PMS or the state would like to see in other communities? Are we the first in New Mexico, or is this happening in other places too?
It's happening in other places. We are the first in San Juan County.
Right.
I know PMS is looking at other areas throughout the state where they're getting ready to start up some mobile crisis in a couple other communities, which is wonderful.
Yeah, no, very, very true. Because again, this is an issue statewide, nationwide, really. So it would be nice to see that in more places. But I'm glad that we are offering it now in the community. And again, I'm proud to be part of PMS, who's able to offer it as well. So it's another great resource. And again, kudos to you and your staff for putting it together and working with these partners to make it happen. Because again, it's difficult to have someone that qualified to be there 24/7. So that's important to know. Just about out of time, Kristine, but I want to go back and talk again about Drums of Fall. You're still looking for sponsors and vendors and things like that. So if folks would like more information, they can go online or call if there's an issue going online.
Absolutely. Just check out the website. Give us a call. We'd love to share information.
Right. Take a look and see. You've got different, I guess, is there different prices for vendor spots? Some large, some small?
The vendor spots in general are $75 each.
Okay.
They are more than that for the food spots or for the food truck spots.
Got it. Very good. And then for sponsorships, I imagine you have different levels of sponsorship?
We have different levels of sponsors. They start with anything up to $500 and then go all the way up to, I believe, $5,000 is our top sponsorship level. And various different advertising packages go with that.
Okay. But if somebody wants to send you a check to be a sponsor, you'll wheel and deal. You'll make them a deal.
Absolutely. We'll take anything.
There you go. So that's how you can do it. The QR code is on the screen. But again, also the phone number. If the website isn't having a good day, you can call and actually talk to a human being, a person.
Yes.
And you can give them a call. 505-443-4305 is the number to either sign up as a sponsor or a vendor or to just ask another question that I haven't asked you this morning.
Yeah, absolutely.
That's what folks can do. And again, mark your calendars for Saturday, September the 12th, out at McGee Park at the Coliseum. It is the annual Drums of Fall, the 21st. And again, that number
it's crazy.
Yeah, it is. 21st annual Drums of Fall. It's a great event, a great celebration of culture, and just a great way to celebrate what it means to live here in the Four Corners, which is a wonderful event. So thanks for coming and talking about it with me this morning.
Thank you so much for having me.
You bet. Good to see you. That is Kristine Carlson-Werito, my guest this morning from Presbyterian Medical Services here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.